Hello, and thank you for joining today's virtual education program with Cancer Support Community Los Angeles. I am Larissa Montalvo, and I welcome you to this week's webinar titled Lymphedema After Treatment for Breast Cancer, a discussion on prevention, risk factors, current and emerging treatment strategies. Today, we will be joined by Dr. Stephanie Angarita and Dr. Ashley Marumoto, breast surgical oncology fellows from Cedars-Sinai Medical Center, to discuss the risk factors for development of lymphedema, the best strategies for prevention and management, and the importance of early diagnosis and intervention. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at www.cancersupportla.org. Without further ado, I would like to welcome today's speakers. Dr. Stephanie Angarita completed medical school at the University of Michigan Medical School and general surgery residency at the David Geffen School of Medicine at UCLA. She is now completing her fellowship in breast surgical oncology at Cedars-Sinai Medical Center. After fellowship, she plans to have a practice dedicated to the management of benign and malignant breast disorders. Joining Dr. Angarita is Dr. Ashley Marumoto. Dr. Marumoto completed medical school and general surgery residency at the University of Hawaii John A. Burns School of Medicine. She is currently a breast surgical oncology fellow at Cedars-Sinai. At the conclusion of fellowship, she plans to return home to Hawaii to work as a breast surgeon. Oh, I'm jealous. Welcome, Doctors Angarita and Marumoto.
Thank you so much.
Thank you for being here today. The floor is all yours.
Great. Let me share my screen here. All right. So again, thank you everybody for joining us today. We're very glad to be able to share with you a little bit of our training experience and knowledge in this area to the community that we serve. So today we're going to be talking about breast cancer related lymphedema. We're going to try to cover a range of topics within lymphedema, basically covering the lymphatic system anatomy and physiology, the definition of lymphedema, risk factors associated for the development of lymphedema, tools for monitoring and diagnosing lymphedema, and then strategies for prevention, and then ultimately treatment options, which include both non-operative and surgical strategies. So what does the lymphatic system do? The main purpose is that it balances fluid and proteins in the bloodstream by transporting what's called lymph fluid. And it does transport a lot of this lymph fluid, including up to a few liters a day. The main function is to transport proteins in this fluid. So the arrival of proteins to lymph nodes then triggers your body's defense mechanisms. Excess water is also removed via the veins of lymph nodes. The lymphatics also help in fat digestion. So certain fat molecules are too big to travel across the blood vessel capillaries in your gut system. And so they have to be transported via the lymphatic vessels first. And then probably what it's most known for to us, the lymphatic system helps us to surveil against infections and cancer. So cellular debris like dead cells after an infection or inflammation, and foreign materials like tattooing can be picked up by the lymphatic system and helps clean it out. The lymphatics drain specific parts of the body. So you see in this diagram here on the left, this depicts the superficial or the skin drainage territories. This occurs by lymphatic vessels that have valves in the deeper collectors, which create a one-way transport system. The lymphatic system is actually part of the bloodstream ultimately. You see the lymph node drainage territories in various parts of the body that are responsible for taking care of the lymph flow in those specific areas. So here you see the cervical nodes in the neck that takes care of the head and neck area. Axillary nodes in the armpit take care of lymphatic drainage from the arm and from the breast and back area. And then some more central nodes in your chest also help drain lymphatic from your breast and from above your collarbones as well. Down here in the groin, the inguinal lymph nodes help to drain your lower extremities, the legs, and parts of the rectum. And then there are basins around the aorta that help to drain some of your internal organs. Ultimately, all this lymphatic fluid then empties into the thoracic duct on the right side of the chest, and it travels up the right side of the chest for a distance, and then it crosses over and then travels up the left side and then empties into a big vein in the left upper chest area. And that's how all the lymph fluid eventually ends up back in your bloodstream. So what is lymphedema? And how does lymphedema develop? Normal lymphatic flow takes place in a low pressure system, just like your veins, but blockage of lymphatic fluid then results in impaired lymphatic circulation, and that results in abnormal accumulation of protein-rich fluid. That ultimately leads to tissue swelling, which is not like the regular tissue swelling you see in your legs, like after standing up all day or eating a big salty meal. That swelling, typically goes away using your blood vessels and veins. This kind of tissue swelling from lymphatic fluid requires your lymphatics to work. And so if those are blocked up, that swelling has a really hard time resolving. This fluid buildup and swelling can also lead to decreased tissue oxygenation, and that can lead to slow tissue healing. And over time, if the swelling is not managed properly, it can stiffen and lead to fibrosis. It's important to note that this process impacts the entire region of the body that is affected by that particular lymphatic drainage system. So after an axillary node surgery in your armpit, lymphedema can occur in that arm, but it can also occur in the hand, in the fingers, in that side of the breast and chest, and even the back. So there are two main groups of lymphedema classified by the cause. There's primary lymphedema, which is due to congenital disorders of lymphatics, which are pretty rare. Most of the time, lymphedema comes from secondary causes that are acquired during one's life. And a big cause is cancer. A number of cancers can cause lymphedema, but breast cancer is the most common one associated with lymphedema because we often do axillary surgery for lymph node staging and treatment. Other cancers that are associated with lymphedema include sarcomas, gynecologic cancers, and melanoma. With regard to axillary surgery, the extent of the surgery and the number of nodes that are removed are big determinants of the risk of developing lymphedema, and we'll talk about that a little bit more. Other causes and risk factors include radiation, which on its own can cause lymphedema, but when you add that on top of axillary surgery, can further increase the risk. In addition to that, trauma as well as infection can cause lymphedema too. And finally, being overweight or obese is another big risk factor for increasing one's risk of developing lymphedema. To understand what we do to the lymphatics and lymph nodes in the axilla or the armpit, I'll briefly walk through how breast cancer was and is currently treated. Historically, when a woman developed breast cancer, she underwent a massive operation like this that involved the removal of her whole breast, chest wall muscles, and all the associated lymph nodes in what we call level 1, 2, and 3 of the armpit. This was done up till about the 1960s, and this was clearly very disfiguring for women and had a very, very high incidence of lymphedema. Fortunately, we've come a long ways from that. Nowadays, most women just undergo a lumpectomy, but even when a woman undergoes a mastectomy, it's much more limited and preserves the chest wall muscles. In terms of axillary surgery for lymph nodes, the majority of women will only need a sentinel node biopsy, which is a procedure that our mentor, Dr. Giuliano, devised. During a sentinel node biopsy, blue dye or radiotracer is injected into the breast, like so. And that flows into the breast lymphatics and then into the axilla, which helps to identify the first draining lymph nodes of the breast. These nodes have been shown to accurately predict the involvement of more nodes in the axilla. Depending on the extent of the cancer involvement in the sentinel nodes, the type of breast surgery one undergoes, and whether someone has had chemotherapy before surgery, further removal of lymph nodes may not be necessary. In these cases, with just a sentinel lymph node, only a few lymph nodes are removed, leaving much of the armpit and the lymphatics undisturbed. In some cases, further surgery in the armpit may be required in the form of a complete axillary dissection. But even in these cases, we remove levels 1 and 2 of the axilla as opposed to all 3 levels like we did historically. Now, the number of lymph nodes that you remove in a full axillary dissection varies a lot. I get this question a lot from patients. How many are you going to remove? We don't know that until we finish the operation and the pathologist counts them. So this can range from fewer than 10 nodes to over 30 nodes, depending on your own anatomy and makeup. What the surgeon does is we remove the nodal content that's encapsulated by fat, so we don't actually see the nodes, but we remove this area that's defined by the anatomic borders of the axilla. And then we hand it off to the pathologist, who then count the number of lymph nodes. So we'll find out the number when we get our pathology report back. Historically, lymphedema rates were well above 40%. With sentinel lymph node biopsy, this has come way down to 0 to 7%. With an axillary node dissection, the risk of lymphedema is higher as expected because we're removing more nodes, but it's still lower than in the past. It's about 15 to 25%. Another major component of breast cancer treatment is radiation. Radiation to the lymph nodes is another risk factor for lymphedema. The need for radiation depends on the type of cancer one has and a type of surgery that a woman needs to have. After a lumpectomy, a woman needs to get radiation to her breast, but not necessarily to her axilla. After a mastectomy, a woman needs radiation to her chest and axilla if the cancer is very large or if the cancer is involving a number of lymph nodes. This is a helpful graph to show how the risk of lymphedema is affected by the extent of surgery in the axilla with and without the addition of radiation to the nodal basin over the course of 5 years. So this is the timeline over 5 years or 60 months. And you can see here the pink line is the risk of lymphedema over those 5 years without any axillary surgery or radiation, just with breast surgery. So you can see here that even with just breast surgery, there's a slight risk of lymphedema over 5 years. The 2 green lines here show the risk of lymphedema after a sentinel node biopsy. The darker green line with just sentinel node biopsy showing the risk up to about 7%, similar to the pink line, in fact. And the addition of radiation in the light green line raises that risk to closer to 13%. The 2 blue lines here similarly show the risk of lymphedema with an axillary node dissection. The darker blue line with just the axillary node dissection with a risk up to about 25% over 5 years. And the lighter line is when you add radiation on top of the axillary dissection, which gives the highest risk of lymphedema as expected, up to about 30+%. So we really try to avoid that if we can. So when does lymphedema develop? Most often, lymphedema development peaks between 1 and 3 years postoperatively, but the timing of lymphedema development varies with treatment. Lymphedema development occurs more rapidly in those who have undergone axillary node dissection and commonly occurs within the first year. For women who also undergo radiation, though, if the lymphedema develops, it often occurs at around 1.5 to 2 years after an axillary dissection and radiation, but a little bit later after you've gotten a sentinel node biopsy. So that tends to come upon about 3 to 4 years after radiation if you've gotten just a sentinel node biopsy. So the range of the development of lymphedema varies a lot. What does lymphedema feel like? A lot of people describe it as a tightness or heaviness in the limb. That's the most common symptom that people report. They might feel achy, pins and needles. Sometimes they just report an odd sensation, sometimes a pain of congestion and some discomfort, but it's not an unbearable pain, just a kind of annoying kind of pain. And it's not the same kind of pain as muscle soreness. Some of the early signs and symptoms of lymphedema. So like I mentioned, many women will feel heaviness in their arm. That's usually the first sign and symptom. They might notice swelling that is initially pitting. So when you press on them and release, the indentation stays. That's what we call pitting. Swelling will often involve the forearm and not include the hand at this point, and the breast may even appear swollen. Some of the later signs of lymphedema include severe enlargement of that extremity. Later on, skin changes may evolve, which is something we call peau d'orange, which is when the skin has the appearance of an orange peel. The skin may also become thickened and even woody like this extremity, but this is a very, very advanced case that we really don't see that often at all. Something I will bring up that is an exceedingly rare complication of lymphedema, of long-term chronic lymphedema, is something called Stewart-Treves syndrome, which is a lymphangiosarcoma that develops in an area of chronic long-standing lymphedema. These are generally very, very aggressive cancers, but the incidence of these tumors are very, very low, especially now that we don't perform radical mastectomies like we did historically. We can stage lymphedema based on the severity. So these are the stages. Stage 0 is at risk, somebody who's at risk and asymptomatic. Stage 1, you see just subtle changes only that are mostly present during the day and mostly goes away at night. And it reverses, it resolves on its own. Stage 2, you get moderate swelling that resolves with elevation of that extremity, that can be resolved, but usually not on its own. Stage 3, you get more severe swelling that doesn't resolve with elevation, and really at that point it's more irreversible. And stage 4, you get significant swelling with thickening and hardening of the skin, like I showed in that photo, and really at this point it's quite irreversible. So this is just photos depicting the different stages. So you can see here subclinical or stage 1. It's not very visible, really, but you might have symptoms. The lymphatic transport is impaired by a certain degree, and you might have symptoms of heaviness and such, but there's no actual objective change in the limb measurement. Stage 2, you get some early onset swelling that's visible now and subsides with elevation, and there may be pitting present, and there's about a 5 to 20% increase from the baseline circumference of that arm. In stage 3, there's a consistent volume change now. Elevation rarely reduces the swelling, and you get progressive tissue fibrosis or that hardening and scarring that we talked about. And that usually you get about a 20 to 40% increase in the circumference from your baseline. And this is a late stage, stage 4, you get skin thickening, hyperpigmentation or darkening of the skin, increased skin folds, fibrotic tissue, and that progresses to a non-pitting edema. And that really is, a greater than 40% increase in the circumference of your arm compared to what it is at baseline or compared to the unaffected arm. How do we diagnose lymphedema? So when a patient feels the symptoms of lymphedema, there are a number of tools that we can use to formally diagnose lymphedema, but this isn't necessarily needed, and symptoms alone are enough to diagnose lymphedema. So it's what we call a clinical diagnosis. Keep in mind, though, that these symptoms that a patient feels may not necessarily correlate with measurable lymphedema. So some patients may report a significant degree of heaviness and discomfort, but we may not be able to see it objectively. So blood, urine, and tissues tests are not needed to make the diagnosis of lymphedema. Imaging is not needed, but it can be used for confirmation of it, can be used to evaluate the extent of the involvement of lymphedema, and to determine any therapeutic interventions that we might have. So I'll just briefly go over how we do evaluate objectively lymphedema. The gold standard is what we call lymphoscintigraphy. So these are some of the images that we might get from lymphoscintigraphy. Radiotracer is injected first into the hand or the wrist, and that's taken up by lymphatic vessels and nodes. And then a photon emission CT scan, then it assesses the dermal backflow and the lymphatic blockage. So you'll see then that lymphatic fluid is blocked up, and you'll see it lighting up in areas where the flow is not great. Another way is just straightforward limb circumference, where we measure the limb at various points on the wrist and the forearm and the upper arm. This is something called a pyrometer, which uses a photosensor that helps to measure and has all these fancy calculations that help us determine the volume instead of the circumference. It's the volume of the extremity. And then finally, there's bioimpedance spectroscopy, where some electrodes are placed on the arms and legs, and the device sends a very small imperceptible current to measure the extracellular fluid in the tissues. So that's some of the ways we can diagnose objectively lymphedema. But like I said, it's a clinical diagnosis that does not require any imaging or tests. It can be purely based on symptoms. So now that we've gone through a lot about what lymphedema is, what causes it, what it looks like and feels like, and how to measure it, Dr. Marumoto is going to take over and talk about how to prevent lymphedema and what treatment options we have when it does happen.
Thank you, Steph. Okay, so if you've been diagnosed with lymphedema, you'll require treatment with a certified lymphedema therapist who specializes in this condition. Women diagnosed with lymphedema often have a number of questions. They wonder, can their lymphedema be cured? While stage 1 or mild lymphedema can be reversed, many experts don't feel that it can truly be cured. This is because even with early stage lymphedema, there's a risk for future episodes to develop. That being said, mild lymphedema can go away with treatment and may never become a major problem. However, for some, the condition can worsen. Unfortunately, later stages cannot be completely reversed, though symptoms can improve. Women often wonder, will lymphedema treatment be needed for their entire life? Again, that depends on the stage at diagnosis and your response to treatment. At one end of the spectrum, a patient may have very mild symptoms that flare up only occasionally, while at the other end of the spectrum are patients who have severe lymphedema that require treatment for the rest of their lives. Most patients, however, fall somewhere in between, with needs that change over time. Over time, you'll become aware of your body and what's needed to keep lymphedema controlled for you. Most importantly, while active treatment will not necessarily be a part of your everyday life, you will always need to be aware of the risks associated with lymphedema. So this is a really nice quote that summarizes the reality of lymphedema. This can be frustrating for many patients on top of their breast cancer diagnosis. It may be helpful to network with others who also have lymphedema diagnosis. There are many resources available to help cope with this diagnosis, manage symptoms, prevent complications, which we'll discuss in the upcoming slides. One of the most important things you can do to prevent the development of lymphedema or complications if you have already been diagnosed with lymphedema is to prevent infection. Skin care and hygiene is of utmost importance and includes keeping your at-risk body part clean and dry, applying moisturizer to prevent chapping, paying attention to nail care, and considering not cutting your cuticles to prevent injury or introduction of infection, and using care with razors. It's important to prevent and monitor for signs of infection. So if a scratch or a puncture on your skin occurs, it's important to wash it with soap and water, to apply topical antibiotics and monitor it closely. If you develop signs of infection, including rash, itching, redness, pain, increased skin temperature, swelling, fever, or other flu-like symptoms, be sure to seek medical attention. It might also be a good idea to keep a first aid kit when you are traveling in case you develop nicks in the skin or areas that need some attention. And if you have lymphedema and develop an infection, be sure to seek prompt medical attention. The lymphatic system helps drain toxins, and if this is impaired for any reason, as in lymphedema, your body may not be able to fight infection as effectively. Just as breast cancer treatment created a new normal, lymphedema treatment will too. You'll be connected to a certified lymphedema therapist who can help you navigate through this process. Everyone's condition is unique, and it's helpful to come up with a treatment plan with your lymphedema therapist and your team. The following questions may be helpful to address with your therapist. How severe is your lymphedema? Early stages are often treated with compression sleeves alone, while moderate to severe lymphedema is often treated with more aggressive exercises and therapies. It's important to know if there are triggers for your lymphedema. Some women experience lymphedema flares if it's hot outside or when they are exercising. A treatment plan will need to account for these triggers. Something to consider too is cost a concern? Not all lymphedema treatment may be covered by your insurance, so it will be important to talk about this with your specialist. Right now, a bill known as the Lymphedema Treatment Act is under consideration by US Congress, and if this bill passes, it would require Medicare to cover all treatments for lymphedema, and hopefully other insurances too. For now, work with your doctor and team to address concerns related to cost, because often these can be managed. Lastly, what are your goals for treatment? Think about what you want to get out of treatment and discuss this with your therapist. Do you want to be as aggressive as possible, even if this requires more time and energy? Or is just controlling the symptoms and getting your lymphedema under control enough? Your treatment plan can be tailored accordingly. Some patients may wonder if arm elevation can help with lymphedema. While research has not shown that elevating the arm can improve lymphedema, some experts believe that it can be helpful for very early stages of lymphedema, as discussed previously. This can involve propping the arm up on a pillow so that the hand is above your wrist and your elbow is above your shoulder. This allows fluid to move up the arm. You can do this a few times throughout the day, perhaps while reading or watching TV. Your lymphedema therapist can assist you with the technique and how often and how long. Maintaining a healthy weight is important for lymphedema prevention and preventing complications from lymphedema. Patients who are overweight are more likely to develop lymphedema or experience issues with lymphedema. Additionally, being overweight also increases the risk of breast cancer recurrence, so it's doubly important to take steps to reach and maintain a healthy weight. So let's talk about treatment for lymphedema. For patients with moderate to severe lymphedema, something called complete decongestive therapy is the gold standard and includes bandaging, which is usually done every day for a few to several weeks and is worn day and night. Compression garments, lymphatic drainage, exercise, and skincare. And we'll discuss these in the upcoming slides. Complete decongestive therapy involves two main phases. Phase 1 is the reductive phase, meaning that the goal is to remove the extra lymph out of the arm, hand, or other part of the body. This typically involves seeing your lymphedema therapist 5 days a week for lymphatic drainage, bandaging, and exercises, and can last from 3 to 8 weeks, depending on how long it takes for your symptoms to improve and your swelling to decrease. Phase 2 is the maintenance phase, and as it sounds, the goal is to maintain the results of the complete decongestive therapy. Phase 2 will be a phase that will last for many years in order to keep lymphedema at bay. It includes compression sleeves and garments and self-care. You may even go between phase 1 and phase 2 at different points in your life. You may also find that lymphedema never becomes a major problem for you again, or that it's only a problem in certain situations, such as hot weather or activities involving the heavy use of your arm. Your lymphedema therapist is there to assist you along the way. Next, we'll go through the components of CDT. Bandaging is used in the reductive phase, meaning that the goal is to reduce swelling. Bandaging can help accomplish this and involves creating a soft cast on the arm or upper body by wrapping with multiple layers. Bandages need to be worn at all times except for showering, and your therapist will teach you how to put them on and off. The goal is to help fluid move up and out of the arm, so there will likely be more layers further down your arm and fewer layers higher up. This creates a graded pressure along your arm, allowing the bandages to feel snug but not tight. Always work with a well-qualified lymphedema specialist to learn how to apply the bandages. And do not try this without the guidance of your lymphedema therapist, as incorrect bandaging may make lymphedema worse. Compression sleeves and garments apply pressure to the arm, hand, or trunk to keep lymph moving in the right direction. Compression garments may include a sleeve worn on the arm, or a fingerless glove, or a supportive bra or vest even. They're made of flexible fabric, and the tightness is often graduated, similarly to the bandaging, meaning that it's tightest near the hand and less tight as it goes up the arm. Your lymphedema therapist will help you determine how often you need to wear this. Is it all day or part of the day, or just for things that trigger lymphedema? Be sure to get your compression garments from your lymphedema therapist or from a durable medical equipment company. Compression sleeves should be fitted by someone with experience in lymphedema treatment, and measurements are needed to select the right sleeve or garment for you. And remember again that an improperly fitted sleeve can even make lymphedema worse by placing too little or too much pressure on certain areas. This is often used in the maintenance phase of CDT to keep swelling at bay. Breastcancer.org has links to manufacturers for compression garments if you're interested in learning more information. Manual lymphatic drainage uses light touch to move excess lymph and fluid out of the tissues and back into the lymphatic vessels. It's much gentler than massage that we traditionally think of, and should feel as if the skin is being brushed, not necessarily rubbed or kneaded. One session of manual lymphatic drainage typically takes about 20 to 45 minutes. Be sure to keep in mind that if you're having manual lymphatic drainage during or after radiation treatments, your therapist should avoid any irritated areas of the skin. And manual lymphatic drainage is considered safe even if you have metastatic breast cancer or cancer that has spread beyond the breast. Exercise is likely to be an important part of your treatment plan. In the past, many feared that exercise could worsen lymphedema, so patients were often advised to avoid exercising the arm. But now research shows that exercise under the supervision of a lymphedema therapist, with care taken not to overstress the arm, lymphedema is not likely to worsen and may even be reduced, and flare-ups may even be reduced. Generally, stretching, flexibility, and aerobic activities are recommended. There was a study called the Physical Activity and Lymphedema Trial, which found that strength training was safe for most women at risk for or already diagnosed with lymphedema, and that it could even reduce the number of symptoms that people have. In one part of the trial, breast cancer survivors with stable lymphedema either continued their current exercise regimen or began weight training under the supervision of a specialist. Women in the weight training group were not at any higher risk of developing arm swelling and also had lower incidence of lymphedema. That being said, when exercising, it's recommended to wear compression garments, go easy, modify your workout to prevent overuse or trauma, and be sure to learn these exercises under the supervision of a lymphedema specialist. As previously discussed, self-care and infection prevention is an important component of lymphedema prevention and treatment. This includes infection prevention and prompt diagnosis if an infection develops, as well as maintaining a healthy weight and regular exercise. So women often wonder if surgery can cure lymphedema. If you have severe lymphedema that's not responding to treatment, you might consider talking with your lymphedema therapist or physician about other options, including surgery. But it's important to know that surgery is often palliative, which means that it's used to control symptoms or discomfort related to lymphedema. Liposuction may be considered, but this doesn't necessarily cure the lymphedema. It can get the arm down to a size that the patient can then maintain with bandaging at first, and then this is often followed by wearing a compression sleeve. Surgery to create what's called a lymphovenous anastomosis, or a connection between the lymph node and the blood vessel, can promote lymphatic drainage too. Nonetheless, it's important to remember that surgery for lymphedema is not curative, has potential complications, and is really reserved for patients with severe symptoms that interfere with daily life and is a last resort. You may also wonder if surgery can prevent the development of lymphedema. And there are new emerging techniques that are hypothesized to reduce the chance of developing lymphedema. And they include something called axillary reverse mapping, or the Lympha procedure. In axillary reverse mapping, blue dye is injected into the arm, and this blue dye travels up the path of the lymphatic drainage and into the armpit, which is where the surgeon performs the sentinel node biopsy. And this allows the surgeon to see and protect the lymph nodes or lymphatics that turn blue. However, one issue with this is that some of these nodes that drain from the arm are also lymph nodes that are supposed to be removed during the cancer surgery. And there's concern that if they harbor cancer, they should be removed. This is thought to be a rare finding, however, and use of this procedure, the axillary reverse mapping, is currently being researched in a national trial. So hopefully we'll have results in the next couple of years. There's also something called the Lympha procedure. This stands for Lymphatic Microsurgical Preventative Healing Approach. This is a surgery that maintains lymphatic flow by dunking a transected lymphatic into a vein with a competent valve. You can see here that lymph nodes surround the axillary vein. And when we remove some lymph nodes, we can take part of the lymphatic and put it into a branch of put it into a branch of the axillary vein, which will help lymphatic flow as seen here. To wrap things up, let's review some common myths surrounding risk factors for lymphedema, like is it safe to fly or have an IV placed in your arm or have blood pressure drawn? So does exercise cause lymphedema? As we discussed previously, the answer is no. In fact, it's important to exercise after surgery. Based on the current evidence, early activity and exercise, when progressed gradually and slowly under supervision, appears to be safe with the added benefit of increasing endurance, strength, and range of motion. So many people wonder, is it safe to get blood pressure taken in the arm after you've had lymphedema surgery? The answer is probably. The American Society of Breast Cancer Surgeons states that getting your blood pressure taken on the side of prior lymph node surgery or prior breast surgery is okay, and there's no strong recommendation not to. Of course, if you can on the other arm, go ahead and do it. But if you're totally unable to, it is safe to get your blood pressure drawn on the side where you had lymph node surgery. People often wonder if getting your blood drawn after lymph node surgery can cause lymphedema. And the most important thing to remember about this is that anytime there's trauma to the arm, there's potential for infection. And we know that infection is a strong risk factor for lymphedema. So getting your blood drawn is considered low risk, but not zero risk for the development of lymphedema. Again, the American Society of Breast Cancer Surgeons states that getting your blood drawn on the side of prior lymph node or breast surgery is okay. If possible to have blood drawn in an extremity that did not have a lymph node operation, that would be ideal. However, if there's no other choice, it's okay to have your blood drawn on that side. Be sure to tell the person drawing your blood that you are at risk for lymphedema, and ideally, one attempt at blood draw will be made. So will flying after lymph node surgery cause lymphedema? And patients often wonder, do I need to wear a compression garment? So there's a theoretical risk of lymphedema to the at-risk body part when flying due to decreased cabin pressure in the airplane. Also, keep in mind that stasis or lack of movement can also cause swelling. This can also cause blood clots in people with or without lymphedema, so be sure to monitor for signs of asymptomatic or one-sided extremity swelling, as this could be a sign of lymphedema or something else, such as a blood clot. So that being said, it's important to get up regularly and move around during any travel. But in regards to flying in lymphedema, there's scant and contradictory evidence to support the use of compression garments to prevent the development of lymphedema. However, if you have a confirmed diagnosis of lymphedema, you should wear some form of compression therapy while traveling by air. All individuals traveling by air are advised to move their limbs frequently to help prevent swelling. You may wonder if diuretics can help treat lymphedema. Although diuretics can be helpful in reducing certain types of swelling in the body, such as swelling in the legs due to heart failure, they have no impact on the excess lymph in your arm, hand, or other areas of your body affected by lymphedema. After treatment for breast cancer, there are things that can predispose a woman to lymphedema. We have certainly stressed this throughout the talk. An infection is an important factor associated with the development of lymphedema after breast cancer. So be sure to prevent and monitor for signs of infection. Obesity is another such factor. Higher BMI highly correlates with the development and increased severity of lymphedema. So weight loss reduces lymphedema, breast cancer recurrence, and survival after breast cancer. So there are many reasons to maintain a healthy weight. You may notice that there are certain triggers of lymphedema. These are important to recognize and avoid if possible, obviously injury or trauma. So consider wearing gloves while doing activities that might cause injury and try to avoid punctures if possible. Also, avoid constrictive jewelry or clothing and avoid heavy bags over the arms or chest that could be constrictive or restrictive. If possible, avoid blood pressure cuffs, but if needed, like we said, this is okay. Avoiding extremes of temperatures, which can cause some rebound swelling, may also be helpful to avoid if that's a trigger for you. To summarize, prevention is of utmost importance. Skincare and weight loss are the two most important ways to prevent the development of and complications related to lymphedema. In summary, breast cancer surgery for early stage breast cancer is now less invasive than it used to be, and as a result, lymphedema rates have decreased dramatically. Preventing the development of infection is the most important factor in preventing the development of lymphedema. And if symptoms develop, it's important to discuss this with your doctor and begin lymphedema treatment with physical therapy and possibly compression as soon as possible. Surgical techniques are being developed to see if we can reduce the rates of lymphedema even further. Stay tuned. And be sure to talk to your doctor about questions you have about lymphedema throughout your breast cancer treatment, even before surgery. There are a number of online resources for lymphedema that can be used to supplement discussions with your doctors. The last resource here has a number of excellent videos covering many different topics related to lymphedema. And Lymphedema Month, Awareness Month was in March, so they're fairly recent. And we will take questions at this time.
All right, so I think we have one question here. I'm just going to read it out if that's okay. 2 lymph nodes removed from both arms following breast surgery about 10 years ago. I was told not to have any skin punctured by needle or blood pressure taken with a cuff on either arm after surgery. I developed lymphedema in my left arm 2 years after surgery. I have since had blood draws on my foot. I would prefer to have blood drawn from my good arm. I'm wondering how big you think the risk would be of developing lymphedema if I did that. Actually, I'm going to take that since.
Yeah. So thanks for the question. It would be okay to get a blood draw on an arm that didn't have from both arms. Yeah. Physicians have different opinions regarding the extent of risk in getting blood draws with lymphedema. The overarching recommendation from our society is that it's generally safe, but talk to your doctor about if they're okay with you getting it from the arm without the lymphedema, even though you had lymph node surgery on that side. Sometimes it is hard for patients who have had bilateral or surgery on both sides, and it is possible to have blood draws in the lower extremity. But of course, there is some discomfort with that. So I think we would recommend that, it probably is safe, but it's important to communicate with your physician, especially if they've been the ones that have recommended not having it drawn in that arm.
It may also be related to how often you need to get blood drawn. If it's, once in a very long while, it's probably much lower risk than, say, if you were having to have blood draws routinely on a weekly or monthly basis. All right. Another question, is there a correlation between dietary protein and or fat and lymphedema? That's a really good question. I don't believe that we have literature to suggest that your diet in and of itself affects lymphedema rate, but your diet can affect your weight, which can definitely impact your risk for lymphedema initially and for worsening lymphedema.
And there are a lot of great online resources. If you Google lymphedema, there's a lymphedema network. So that covers a lot of areas if questions arise, even before surgery.
I'm just going to share that resource screen again in case anybody wanted to take down.
Well, thank you for having us today. We really appreciate it.
Thank you. It has been our pleasure to host both of you today. Such wonderful information that you shared. We're very excited to have done this. This will also be recorded on our video library for those of you who joined us late. So we're very excited to have this information. You can always reference back this PowerPoint. All right. Well, thank you both for being here. It has been such a pleasure. This was wonderful information, and we hope to host you again in the future, maybe one day in person.
That would be great.
That would be great. Thank you all so much. I hope this was helpful.
Absolutely. Thank you. Have a great day, everyone.
You too. Bye-bye.